So as we give a minute to people to take the seats, change room, come into the room, I'll very quickly say hello from my side. So I'm Alex Haitoglu. I'm the founder and the CEO of Ovida. Our mission is to use AI to help unleash human potential. And we're going to talk a little bit about some of the work we're doing with the Mayo Clinic, specifically on coaching healthcare professionals on how to communicate with patients. So a couple of quick things about Ovida. So we really care about measuring behavioral change. So really being able to help people change their behavior, but put numbers to that behavioral change. We want to really enhance what is uniquely human, and we want to prove that it works where it matters most. As part of that, we have a host of different organizations. The use cases for us are, there's a medical use case, but we're also doing things like wealth management, where actually financial coaching is super, super important there. Leadership. Coaching is super, super important for leadership. Even cloud sales, even coaching and training. We're working with a few universities, some of the people in the room as well. But we're going to focus today on Mayo Clinic specifically. And there's a really important fact about communication skills for medical professionals. I don't know, guys, if you know roughly how much time people spend with the doctor or the healthcare or the physician. Does anyone know how many minutes roughly is a consultation? 15 minutes, well done, right? So it's about 15 minutes, maybe 20, right? That's not a lot of time. And what's really important here, it's not just it's not what the doctor says, but the change of behavior is on the how. So how the doctor communicates is really, really important. And the reality is that there's a fundamental conversational communication that happens, that we have ways of measuring it. There's already established ways, Dr. Benzo is going to talk about this in a moment, very well established, based on lots of clinical trials, ways of measuring how these communications work, but then it hardly ever happens today. So we want to change that. We're working with two professors, Dr. Benzo, who's here, and also her father, Dr. Roberto. They've been together in this field for more than 30 years together with fully funded research by the NIH. And I'd love to invite Maria to do an introduction.
Absolutely. Thank you. Welcome, everyone. It's been a day. I'm Dr. Maria Benzo. I've been working in health coaching research for the past decade. We are at the Mayo Clinic, specifically the Mindful Breathing Lab. And over this decade, we've coached over 1,500 patients. And our coaching is grounded, like Alex was saying, on motivational interviewing, which is an evidence-based approach. It's a type of conversation that supports behavior change.
One thing on motivational interviewing, which for me was a big surprise when I understood it more, Maria, was how it places the doctor completely into a coach's shoes, effectively, right? So the doctor is trying to help the patient discover, what's the definition there, discover their own motivation for change?
That's right. So motivational interviewing, the beauty of it is that it is evidence-based. It was, firstly mentioned in the 90s, but so many randomized controlled trials have shown how effective it is in making the needle shift to the behavior change. And what it does, it really, the provider, whoever that is, doctors, nurse practitioners, health coaches, they are focused on cultivating and advocating that motivation that's within the patients already, really trying to understand, so showing empathy and understand the context and what matters to the patient, and connecting those dots in a way that the patient feels empowered. So it's not about giving people motivation, it's about evoking their own motivation for behavior change.
So we have this model, it's been very well established, very well researched. What's the problem?
Well, the problem is there's a bottleneck because I've been it's been a decade for me, training health coach teams and overseeing their fidelity. And we use the motivational interviewing treatment integrity scale, which is a great tool because it gives clear instructions to how to assess is a coach adherent to motivational interviewing, things like cultivating change talk, partnership, and empathy. The thing is, To assess a 20-minute session, it takes an expert coder 45 to 60 minutes to get it done. Yeah, I see some nods over there. It's true. I mean, if you really want to have a quality improvement process, you have to do Fidelity. And it's very human, time intensive. So that's where our collaboration came in. And what we did is we trained Ovida AI to generate these automated global score ratings of health coaching sessions. And that gives us two tools. One for the supervisor to be able to review these global scores of many health coaching sessions, and for the coach themselves to see how well they're doing, where their strengths are, and where are there the opportunities to develop their skills.
We had two stages in this process.
Yeah, so the question wasn't only can we train Ovida to do this, is I'm a research scientist, so we were going to validate this. We needed to know, does this really work? So we took, it's a two-stage design. Stage one is really looking at the health coaching session as a whole. So the output is can Ovida give the global domain scores and behavioral counts on a global session, just like we would be doing normally in Fidelity. And we had independent expert coders come in and do the same. So we took only 30 sessions for this stage one validation, because humans were involved. And we recognize that we currently have 2 randomized controlled trials with hundreds of sessions to look at. But since we had to ask our expert humans to come in, we randomly selected these 30 sessions. So that was our stage one, to see, okay, how are we doing session level? But then we wanted to look a little bit further and ask, can Ovida correctly tag specific motivational interviewing behaviors? So here we extracted 600 statements, so it's a statement level validation. It was in a binary classification, so is the behavior present or absent? And these statements were within different motivational interviewing categories. These 600 statements went through the Ovida AI and 3 expert human coders that had to look at these 600 statements. So that was quite a lot of work this past year. But that's how we came to our good results, right?
Results, yes. It's your slide.
Yes, my slide. So yeah, how fun this slide, right? So many numbers, these complicated tables. Alex mentioned this, so we made another slide. Yeah, I mean, you can't take the research scientist out of me, I'm sorry. But all in all, we want to show you what really matters, the bottom line. If you have a coaching team, you want to know if your coaches are passing the bar, right? Are they proficient? Can they deliver high quality coaching? So in sessions as a whole, we have 4 global domains: cultivating change talk, partnership, empathy, and softening sustained talk. This is what we look at as supervisors. Ovida was able to tell if a session was proficient or not in these percentages. So ranging from 87 to 100% in these global scores. So we can tell right away, now with even 500 calls that we have under our belt this year, we can say, okay, our coaches are passing that bar. They're making it happen. And that's exactly what we needed, right? We needed to have a very easy tool for supervisors to know how we're doing. And then, of course, for the coaches to self-develop.
And then we had also the...
Oh, yes. And so statement level validation, this was more so for us because we really want to be able to trust our tool. What we're looking at here is, can Ovida correctly tag behaviors in these different motivational interviewing categories? And how accurate is it, right? So if it's correctly tagging, we're looking at accuracy. And as you can see, we have very good scores, and some of the top performing categories are really the ones that we mostly want to look at, right? So can a coach show understanding, demonstrate understanding of what the patient is going through? Can the coach effectively cultivate that motivation for behavior change. So we're very happy to see that our arguably most important motivational interviewing categories are already very well performing.
What are the implications of this now that we're in this stage of our research?
Well, that's the fun part, right? Because now we can say that we have a tool. We have a tool with validated global domain scores that we trust and we use on a daily basis, and that's scalable, right? We were stuck at the scalability point, and now we're unstuck.
And what are we going to do next?
Of course, we're going to continue to improve the model because we love what we do. We have a strong plan for disseminating this. I think that as I see some eyes opening here, like, ooh, I could use this, I think we need to let more people know that this is available. And the research scientist in me would love to write a paper. So we're planning on publishing our validation results and letting you know how we got there.
And from our side, what has been fascinating, having two experts in Roberto and Maria in this, working with our data and science team to be able to produce these results, and seeing what is the real practical impact on this. All right, doctors and healthcare professionals that understand how they speak to the patient and they're able to genuinely, truly communicate with them better. They help their patients have better results. There's some indisputable RCTs done with a motivational interviewing model that show that, especially in chronic conditions. It reduces dramatically insurance claims. It's a really interesting thing. We're actually starting to work now with indemnity organizations because the doctors that get sued, they're not the doctors that necessarily make the mistakes. They're the doctors that come across as arrogant. I don't know if you know that, but this is actually a thing all around the world. And of course, in anywhere where there's a private healthcare system, the NPS and people coming back does depend a lot on did I have a great experience, did I like my doctor, am I building a relationship there? But what's really interesting here, this is not, as a methodology, it's not just applicable in the case of the MI, it's a methodology that we're now pretty much applying it to everything else. We can apply this methodology in sales and financial planning, we can apply this in coaching, we can apply this in leadership development, which is probably one of the harder ones, because in the rest, you have sort of more specific measures. Leadership is still a little bit more vague, so we need more measures for leadership. But this type of approach and the rigor that we've had with a great pleasure working with you and Roberto on this is what's really start helping us prove we have a behavioral change, it makes a difference, and that's what it means for the real world. We're pretty much done with that. We did want to give a chance to, we're just going to go to the break, but if there's one question maybe we can take from the audience, and then I'm being told to no question. Okay, no question. So we're going to stay here. If you guys want to ask more questions for this one, please come over. This is also my LinkedIn for anyone who wants to connect more. Would love to look for other use cases other in healthcare where Dr. Maria and Dr. Roberto can really, really help, or in completely different use cases where fidelity really matters, because that's what we believe is going to make the difference. If we can connect business and organizations with real results, and that's where AI can do something that we couldn't do before, and enhance what is uniquely human. Thank you very much, and have a very good break.